I'm Rome Henderson. I'm 13 years old. On January 1st, I received my heart transplant at Children's Health.
When she was born, she had an oversized hole in her heart, and she had some narrowing, and she also had a valve replacement. At 3 days old was her first surgery, and at 6 months was her second surgery.
But what was uncommon about Rome is that she started to develop a failing heart. The squeeze and the function of the heart just wasn't normal. But we were able to manage that problem with medications by mouth. And she was doing relatively well right up until the point in time where she had to be readmitted.
I started to feel like I couldn't breathe, and I just wasn't feeling the same.
So on Christmas Eve, she was transferred from Austin to Dallas to Children's Medical because her health was declining more.
She was very, very sick and what we call decompensated heart failure. And so that required her being on a ventilator. And after that, we needed to do something to support her heart.
The care team explained to me that her condition was getting worse and that there was something that we needed to do that was more than just the medicines that she was getting in the IV.
We have to support the heart in a way that is safe. And in her case, she had a heart device called the Impella, which is a left ventricular assist device.
We actually take the heart pump, thread it up from the artery, and put it into the heart, acting essentially like a left ventricle. So it makes the left ventricle not have to pump. And that stabilized her, and she actually did quite well.
When they came and talked to us on Christmas Day, they told us how she needed to be listed as soon as possible, that the Impella was just a bridge before a heart transplant.
It was a very difficult time for that family, as you would imagine. They were dealing with a child who just 2 weeks before had some heart disease, but nowhere near the severity with which they're dealing with now.
Basically, from this point on, we're supporting her circulation system, and at the point where she gets the heart, then the new heart's going to take over for that, but we have no way of predicting exactly when that new heart was going to become available.
We knew that this day would come, and we were fearful, but at the same time, we were positive that everything was going to work out.
And I remember her dad just says, we'll just pray for a transplant.
So when we got the phone call that they wanted to talk to us, we kind of were like, oh no, what could this be about? And so when we walked in the room and we sat down and we would like to present the offer of a heart, we were so happy.
So when we spoke with her, it was evident at that point in time that the surgery would happen on the first day of the new year. And so a new heart for Rome, a new life for Rome, and a new chance for Rome is really what we talked about.
Rome was particularly lucky. Usually patients of her size have to wait at least a few weeks, if not a few months, a new heart becomes available. But because Rome was sick enough and had the mechanical device implanted, she was high on our list and was able to get the heart relatively quickly.
Her care team was amazing. They gave us a lot of information. I liked how they wanted to get to know Rome. Even though Rome couldn't talk to them when we first got there, I liked how they asked questions. They wanted to know what was she into at school, what was her personality. They wanted to see pictures. It's like they wanted to know her.
Rome is doing very well. So she was discharged, or she left the hospital. She has got energy that she doesn't remember the last time that she had the amount of energy that she has now.
She is doing amazing.
The first place I went after I got out of the hospital was Olive Garden. I got lasagna and salad, and it was good.
I would really like to just tell everyone that helped Rome, her care team, all the way from the transplant coordinator to physical therapist, OT, her nurses, just everyone that was there on call when we were there that really just helped us. I would really like to thank them. They were amazing. They did an awesome job.